I hope there's no one in the room who doesn't know that the high levels of the government are discussing ways to cut the federal deficit. And if anyone thinks that's good news for women, think again. I suppose in one sense you could say that if our country were truly at risk of having too much debt, then cutting the deficit is good for everyone. But there are reasons why we're not truly at risk, and the cuts that will be done are so overblown, at least what they're talking about are so overblown, that certainly any benefit from cutting will be outweighed by the real harm that the cuts do, not just to women but to all families, but particularly to women and children. Let me just say a couple of words about the budget deficit and explain why I'm right and they're wrong, and why the mainstream media is wrong. Okay, so there are two budget deficit problems. One is a short-term problem, and the other is a long-term problem. So when you think about the short-term problem, you should be thinking, yes, we had the biggest recession since 1930, since the 1930s, and we still haven't gotten out of it yet. The trough of the recession was in June of 2009. Unemployment continued to increase, and the number of unemployed continued to increase for both men and women. Women's unemployment increased for longer than men's. It took longer for women's employment to go up at all, and it's gone up only a very little bit. Men's has also gone up only a very little bit, but it's gone up a little bit more than women's. So really slow recovery, really deep recession. Why does that create a short-term deficit problem? Well, because when you have less output and less employment, you have less tax revenues. Every level of government has less tax revenues, local, state, and federal. And you usually, especially at the federal level, have more outlays. Why do you have more expenses? Because there are poor people, more unemployed people. They need things. They need food stamps, they need unemployment insurance, they need all these things that they didn't need before the recession. So lucky for the U.S. as a whole, we have a federal government that is not required to have a balanced budget. And so one of the things Obama's stimulus plan did was shift money to the states and local governments. So they didn't have to lay off as many teachers and police and firefighters as they would have had to lay off without that federal help. Plus, a lot of the help is strictly federal money. Unemployment insurance guarantees for long-term unemployed, that's all in the control of the federal budget. Food stamps, that's all federal budget. Medicaid, largely federal budget. Social Security, Medicare, all federal budget. Social Security itself, which we think of as mostly for older and disabled workers, most of whom are older, true, that's older workers, but how does that get spent more in a recession? That gets spent more in a recession because if you're 62 years old and there's no job for you, you think, well, I guess I can go on Social Security early, and you do. And if you're disabled and you were working, but you lost your job and you look around and you say, gee, there are no more jobs for disabled people anymore in this recession, it's so bad, you can go on disability. So Social Security also picked up in this recession. So the short-term problem is the recession. Now we have some other reasons why the short-term deficit is exacerbated. Anybody know why? Remember those wars that are going on in Iraq and Afghanistan? We didn't pay for those wars. We didn't have tax increases. We had tax cuts. So that leads to the third reason for the short-term recession, the Bush tax cuts. Now, very sadly, I have to label them the Bush-Obama tax cuts. I can assure you the Obama White House does not label them this way. They label them as the Bush tax cuts. But in December, after the election, there was that last-minute deal. And in that last-minute deal, Obama agreed to many of the worst parts of the Bush tax cuts. And he did get some increased stimulus for this year. That's mainly in the form of your payroll taxes for Social Security. You may have noticed those going down. Those went down from 6.2% to 4.2% being deducted from your paycheck. And that money is being made up by general revenue, so it's not really being taken away from Social Security. It's just a form to give everybody in the economy more purchasing power. That's a form of stimulus. Even with that, our GDP growth is going down, and that's partly because we have had this incredible fury about how we need to cut the budget. We had the November election results, so there wasn't a very big stimulus. It wasn't as big as we would have liked, and that is causing a slowdown in the economy. What's happening at the local and state level? They tend to have a lagged effect. Their revenues are down, they're cutting, they're laying off teachers, they're laying off police, Congress would not agree to more aid for state and local governments in a moment of insanity, so far as I can see. The president asked for it and they didn't do it. That's all short term. That could all be fixed by getting strong economic growth, for which, yes, at the federal level, we should borrow more money to get stronger economic growth. We could start paying for the wars, and we could end the wars. So all those things could be fixed. We could impose more taxes on the rich, which, believe me, will not contribute to the slowdown. If taking taxes off the rich would create jobs, we would never have had the recession in the first place. Second, the long-term problem, long-term healthcare costs. The government has pretty much targeted Medicare and to some extent Medicaid for ways to control healthcare spending. That's not enough. It's true that the federal government is about half of all healthcare spending in the U.S., but only half. And so to really get healthcare spending down, you have to attack it in the whole industry. And Obama did have some proposals for that, which are also embedded in the Affordable Care Act and healthcare reform. But this is a long-term problem, and we do have to solve that problem. And part of that will mean lowering Medicare expenditures and lowering Medicaid expenditures, at least on a per capita basis, per capita for those who need the services. Because if we don't do that in the long run, we will not be able to compete effectively. Compared to other countries at our level of development, we pay twice as much for healthcare per capita as any other of those countries, and we don't have as good healthcare outcomes. We have higher infant mortality, higher maternity mortality, and lower life expectancy. So we ain't getting our money's worth for our healthcare buck. So that whole industry has to be reformed. That's the long-term problem. So the threats are that people in Congress getting this all mixed up and thinking that we can't spend, we can't spend, we can't spend, and also that we have to set like an artificial cap, like expenditures can only be so much of GDP, or even the deficit can only be so much of GDP. You know, in a recession or slow recovery, you should have your deficit as a higher percentage of your GDP. So that's the background. I'm going to stop there. Jan is going to tell you the rest.
Oh, okay. Geez, that's the best summary of our present mess I've heard in just very few minutes, Heidi. Now an IWPR kind of head up jointly the Older Women's Economic Security Task Force, the acronym of which is OWS. Get it? We have been really, really busy this year and have been busy even before that, mainly fighting off all of these attacks on Social Security. And if there's anybody in this room who thinks that Social Security won't be touched, you know, supposedly the third rail of American politics, touch it and you die, you better think again, because there are groups out there that have been spending millions of dollars lobbying Congress, purchasing ads, running them on cable networks and network TV, and have been on the Hill like a bunch of ants everywhere, and have really sort of set the climate for major changes in the so-called entitlement programs. There are even a number of moderate Democrats that are saying things that are very scary. So we have been doing an awful lot of work at the task force level in communicating with members of Congress, with our membership, with our grassroots, with other allied organizations, and we hope that you can join in because women really do need to make their voice known in this battle. Women are the major beneficiaries of Social Security and Medicare, and they are the major beneficiary of Medicaid, which is also unfortunately going to be on the table. As you may have heard, there is this negotiating team at the White House under Vice President Biden who are talking about the 2012 budget. We are planning on doing an action, which we'll talk about at our update at the end of the program, pointing out the fact that women aren't at the table, even though women are the major beneficiaries and of not only these entitlement programs, but of many other social programs as well, and we're very concerned about the impact there. It really needs to be noted that Social Security has nothing to do with the federal deficit. This is a stupid notion that has been promoted by folks who want to see Social Security ended. And to those of you who are confused about why anybody would want to end Social Security, because it's such a great program, it's very efficient, it saved a lot of older citizens from sinking into dire poverty, especially women. Wall Street and major conservative think tanks want to see you put your retirement money in Wall Street. We all know that's such a great low-risk option, right? So bad things could happen when some of these decisions are made on the 2012 budget. We want to do everything we can to get the word out that cutting Social Security, changing benefit levels, and increasing the retirement age until age 69 is not acceptable. We had a major campaign recently entitled "Don't Ask Us to Work Till We Die," which is basically what people would be doing. So we've got a couple of other activities coming up we'll talk about later. I just want to mention that the trustees report, Social Security trustees report, came out just very recently, which shows that Social Security is still basically very sound. We have $2.4 trillion in reserves. It will be able to pay all benefits up until about the year 2036, providing no changes are made. That is a reduction of 1 year from 2010 in terms of being able to cover our benefits. After that, it can be 77% of benefits. Medicare would be a little bit more drastically affected. Its funding is going to run out in 2024. So, in sum, we are working on a series of proposals, especially with regard to not only improving benefits, but solving Social Security's long-range financing challenge. I put a bunch of materials on the back. One of them is a sheet that shows the improvements to Social Security that we could make if we made a few adjustments in the program, the most important of which would be raising the cap on taxes paid on income from current $106,800 to maybe taking it off completely and having everyone pay their fair shares, millionaires and billionaires included. So we've got a lot of really interesting efforts going on. Please think about coming to our task force meetings and I'll be happy to answer any questions you have. Thanks.
I think Jan mentioned that we are now circulating a letter to the President asking for a meeting with the President and the Vice President to include women's voices and women's issues in the negotiating team. And that's so far just gone to the O's task force organizations. But if you want to sign that letter for your organization, you can instantly join the O's task force. There's no barrier to membership of the O's task force. So far we have about 7 signers. We have about 5 members of the task force who chose not to sign. Feminist majority is one of those. Alice, I hope you'll go back and speak to Ellie about that, because I don't really know why she wouldn't want to sign the letter, just asking for a meeting.
Did she consciously say no, or did she just...
Apparently she consciously said no, through Kim. So just ask her to reconsider. We revised the letter and the statement, and she should have them in an inbox over there somewhere. We just sent them out this afternoon. But 7 groups have already said yes. We're still waiting to hear for 7 members of the task force. We are having a press conference Tuesday morning, a telephone press call. Did you mention that? So, and only those people who sign the letter, if we get the meeting, will be invited to come. Now, obviously, the White House will be in charge of the invitation list, so who knows what will happen. But from our view, we would like only those who sign the letter to be at the table when we got our meeting. Thanks.
And I'll put copies of that letter on the back table so you can grab that and take it with you.